my name is Jessica Demars, and I'm a respiratory physiotherapist here at the Calgary Running Injury Clinic. And I'm here today to talk to you about breathing, and specifically how dysfunctional breathing can leave you feeling out of breath. So before we get into dysfunctional breathing, we need to first understand what normal breathing is. So if we put a hand on our chest and one hand on our belly and just tune into our breathing for a moment, you should notice a couple of things. One, you should be breathing quietly, so you shouldn't be able to hear it. Two, you should be breathing in and out through your nose. And three, the hand on your belly should be moving first and more than the hand on your chest. Ideally, that's how we're going to be breathing at rest, but estimates are saying that up to 40% of people don't breathe correctly at rest. So when we start to exercise, our bodies start using more energy and requiring more energy, and as such, it triggers a signal for us to breathe quicker and deeper to match that demand. So we see a switch to mouth breathing and upper chest breathing, like that, in order to accommodate for that increased demand. Okay. But I see what happens time and time again is that people adapt disproportionately to the amount that they need. So what happens is they start huffing and puffing, breathing really heavy and labored, and the result is that you feel out of breath, which limits your ability to continue, or at least makes you feel very tired. Which makes sense, because it's actually a lot of work to breathe like that. The little neck muscles fatigue quite easily when they're having to lift the chest up all the time. And also, if you're doing this kind of breathing, the upper chest breathing at rest, more often than belly breathing, what happens is the diaphragm, which is our main breathing muscle, tends to fatigue faster. Okay? And so once the breathing muscles start to tire, they trigger a reflex called the metabol reflex. So what happens at this point is your body will actually redirect blood flow away from your exercising muscles, say your legs, and to the much more important breathing muscles. This leaves you feeling short of breath and overall fatigue. The good news is, if you are a huffer and puffer, a little guidance on how to find a more suitable breathing pattern and then strengthening that breathing pattern for your particular body requirements means you'll be off to the races in no time.